Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Age. So today I welcome you again back to the series Regional Surgery. I know I have been inactive since very long, actually 3 to 4 months I guess it has been past, because actually I got transferred from a very prosperous place to a very remote area. So here setting up things was very difficult also. And when you were in a very good place and you get transferred to a remote place, also you get really mentally disturbed also, but it's all right. God's plan is always better than my plan. So first of all, I will apologize because the setting here is not adequate. You may not be getting a good setting vibe here also, because many, even lighting, all those things are not available here because it's a village area. So I hope you will not focus on me or the setup, you will focus more on the knowledge side. Okay, let us start. I will try to be regular. Okay, so today we will be discussing the regional surgery and the affections of guttural pouch in the series regional surgery. I have made other videos also. If you want to check them out, I have also completed the ophthalmology section in regional surgery. I will give the link of those playlists in the description. You don't need to worry regarding this PPT. This PPT will be in the description. The link to this PPT will be in the description. But those who are following, they know that I also give notes, but I am not getting enough time to make notes. But these PPTs will be available in the description. Okay, you can make your own notes. So today we will be discussing the affections of guttural pouch in horse. This is my handles. In the Instagram handle, I am kind of more active in Instagram compared to the Facebook. In Facebook, I post different case reports. Okay, but in Instagram, you will get the updates regarding the videos as well as the notes. So you can follow me in the Instagram and Facebook. These are the articles which I referred while preparing this PPT, as well as the veterinary surgery book. These articles are very good articles. You can search these headlines. It is available in Google Scholar also. So going to the directly the guttural pouch. What are the functions of guttural pouch? So there are multiple functions, like it helps in the equine whining, okay, sound production, flotation device. The most important one is the brain cooling role. In those articles you will find you will find this role, the brain cooling role. How it does, let us see from the anatomy. This is the anatomical structure of guttural pouch. The guttural pouch has been divided into two chambers. This is medial chamber and a lateral chamber. By this bone, this particular bone divides this guttural pouch into two chambers. This is stylohyoid bone. Stylohyoid bone. So this bone separates this chamber. Why this? What are the structures that are found in chamber? Most importantly, you have to remember that many of the important cranial nerves, different cranial nerves, as well as the vessels that are supplied to the brain, passes through this guttural chamber, like vessels like internal carotid artery, external carotid artery, common auricular artery, temporal artery, maxillary vein, maxillary artery. This is nerves, carotid plexus, different nerves passing. This carotid plexus, 7th cranial nerve. Here you can see the 9th cranial nerve, 12th cranial nerve, 10th cranial nerve and the 11th cranial nerve. So many of the important cranial nerves as well as the vessels that supply to the brain, or that nerves originate from the brain, passes through this guttural chamber. So you know that horse is a race animal. Okay, so when it races or runs, the temperature of these blood vessels rise, blood becomes warm. So this chamber feels with air which is in the body temperature. It cools down these vessels supplying to the brain. The important one is the internal carotid artery. It is also important from another aspect, from a disease point of view. We'll go into the latter. Sorry. So these vessels get cooled by the air present in the guttural pouch. So it has a brain cooling function. Okay. So I hope you understood these structures. Mostly you have to remember the vessels and the nerves. Let us see some endoscopical images. This is the endoscopy of the guttural pouch. You have to go through, this is a slit. This particular structure is a slit opening of eustachian tube. Guttural pouch is the modification of eustachian tube in horse, which connects the middle ear to the pharynx. Okay, so you have to go through this slit present in the pharynx. Okay, when you will go through this, you will find these structures. These are endoscopical images of guttural pouch. This is the image of medial chamber. This is the image of medial chamber. The left one is when you are viewing the roof, and the right one is the chamber proper. Okay, why the roof? I will tell you. So this is the stylohyoid bone. This bone is the stylohyoid bone which separates. This is medial chamber. Here is the lateral chamber. Temporohyoidal joint. This artery is very, very important, internal carotid artery, because there is a disease condition known as thrush. See, thrush means fungal infection. Fungal infection of guttural pouch. So whenever there will be fungal infection of guttural pouch, it mostly affects the roof of the guttural pouch and near to this internal carotid artery. Here you will find plaques, fungal plaques. We will see the images, don't worry. For your knowledge I am telling, fungal plaques. So what will happen due to the presence of these plaques? The wall of the internal carotid will weaken and it will lead to aneurysm of the vessel, and when there will be this aneurysm ruptures, it will cause epistaxis. It is more severe condition, it can be fatal. Okay, okay, understood. Internal carotid artery. This is internal carotid artery. This is atlato-occipital joint. Okay, all this are not important, only remember the vessels. So this is the proper chamber. You can see this is 12th cranial nerve, 10th cranial nerve. It's your assignment. You have to name these nerves in the comment section. Okay, like 10th is vagus. Okay, like that. 12th, this is 9th. Here is the 9th. Sorry, this is 11th. This is 11th cranial nerve, 10th cranial nerve, 12th cranial nerve, 9th cranial nerve. Okay, this artery is internal carotid artery. Okay, which is a muscle. Okay, so all these structures passes through the medial chamber of the I have actually sore throat. So this is the lateral chamber. This is the lateral chamber, image of the endoscopical image of lateral chamber of guttural pouch. You can see here, this is auricular artery, common auricular artery. This is temporal artery, 7th cranial nerve passes through this one, 7th cranial nerve. This is carotid plexus. You can see different nerves, okay, arising from plexus. Carotid plexus. This is maxillary artery here. Maxillary adjacent to artery, you will find here maxillary vein also. So all these structures, this is stylohyoid bone. This is the stylohyoid bone which separates. That side will be the medial, this will be the lateral. So all these vessels and nerves passes through this important structure, that is the guttural pouch. Okay, especially in horses. So let us go to the disease. First disease is the empyema of guttural pouch. Empyema of guttural pouch. It simply means accumulation of pus. Empyema means accumulation of pus. Okay. So most often it is commonly secondary to other diseases, most commonly respiratory tract disease, upper respiratory tract infection or retropharyngeal abscess. It is secondary disease, not a primary disease. Palpable visible swelling behind the jaw. We'll see some images. The characteristic or pathognomonic sign is pressure on distended pouch may cause mucopurulent nasal discharge, as well as whenever mucopurulent nasal discharge, especially when head is lowered. Sometimes the horse may graze, okay, in the field while grazing, or while taking water, or while taking the feed in the stalls. From the nose, mucopurulent, very sticky, adhesive discharges will be there only when the head is lowered. This is very much pathognomonic to the empyema of guttural pouch. Chronic cases may develop chondroids. We will see the images. Chondroids. Diagnosis is by clinical signs as well as radiography, and the most accurate one is the endoscopical examinations. Treatment, you can go for medicinal or endoscopical treatment. Surgery you can also perform. Nowadays this is more common in the YouTube. If you will search the guttural pouch of horse, you will find very good images or videos regarding the endoscopy of the guttural pouch. Okay, and surgical intervention, there are 4 approaches we will discuss shortly. So this is the image. You can see this mucopurulent, very sticky, it is hanging from the nose. When the head is lowered, this particular mucopurulent discharge may come out. Okay, this is the radiographical image as well as endoscopical image. This is endoscopical image. You can see the chondroids here. Okay, different chondroids, multiple chondroids actually present here. Okay, multiple chondroids. These are chronic cases, multiple chondroids. Here in the radiograph you can see this is the chondroid here. Okay, another one is there overlapping. So this is how you can diagnose the empyema of guttural pouch. This is another picture of endoscopical image. You can see here this is a chondroid. Now the surgical approach, there are 4 different approaches. First one is the Viebox triangle. The triangle is formed by linguofacial vein in ventral side, tendon of sternocephalicus on dorsocaudal side, and the ramus of mandible on rostral side. We will see the image, don't worry. So incision is given parallel to linguofacial vein. Okay, sorry, parallel to linguofacial vein. We will see the image also. So best for ventral wall approach to the ventral wall of guttural pouch. Another was hyovertebrotomy. The incision is given 2 cm cranial and parallel to wing of atlas for approach to the lateral wall. There is White House approach. The incision is given on the ventral side. Okay, on the ventral side for the dorsal aspect of the guttural, to get access to the dorsal aspect of the guttural pouch. It is very important for when there is mycosis. I told you there will be in mycosis most commonly happens in the roof of the guttural pouch of the medial chamber where internal carotid artery is present. So it causes aneurysm. So for the ligation of the internal carotid artery, this approach is one of the best. Slightly modification is the modified White House approach. It is more, the incision is given more parallel to the linguofacial vein. Let us see the images of the approaches. See the image of the approach. So this is the Viebox triangle. This is the ramus of the mandible. This forms the rostral border. This particular structure is the linguofacial vein. And the dorsocaudally, this is the tendon of this particular tendon of sternocephalicus muscle. Sternocephalicus muscle. Okay. So this particular triangle is important. So when you give the incision inside the triangle and parallel to the linguofacial vein, it is the Viborg's triangle approach. If it is you are giving parallel to the linguofacial and slightly towards the ventral side, this is modified Whitehouse, and if you are giving incision on the totally on the ventral side, this is Whitehouse approach. The higher vertebrotomy, here will be the atlanto-occipital joint and the wing of atlas, you have to feel it. So you have to give the incision 2 cm cranial. This is the wing of the atlas. Here 2 cm cranial parallel to the wing of the atlas. Okay. So this approach is the higher vertebrotomy. These are the 4 different approaches of to approach the guttural pouch in case of horse. If you want the detailed procedure, you can refer the equine surgery by elsewhere publication. That's a very good book. You can refer those books for detailed approaches. Okay, this is the cadaver image to show the Viborg's triangle, how it looks. This is the linguofacial vein here, the linguofacial vein, the tendon of sternocephalicus muscle, here the ramus. Okay. Sorry. So this is the Viborg's triangle. Next, the tympany of guttural pouch. Tympany means accumulation of gas. So it is most common in foals, usually from birth to 1 year of age. It is caused by redundant mucosa on the ventral aspect of the pouch opening that creates a one-way valve. How it happens? So there is the guttural pouch opening. This is the pouch. So this pouch is basically a membrane. Okay. So what happens sometimes when there will be edema, most commonly the edema of this particular membrane. So membrane becomes slightly tortuous like this. So this is the opening. So what happens? Sometimes these folds can be very tortuous and it will be like this. So it will allow the air to pass, but when the air has to exit, it acts as a valve and blocks the outflow of the air from the guttural pouch. So it causes tympany. Okay, it may be congenital or due to edema of the mucosa. Okay, upper airway infection, secondary to upper airway infection. Okay, understood? So this is the clinical side of the tympany. You can see here there is a swelling here, is swelling. Okay, this particular swelling, and while doing the endoscopical image, sometimes it becomes so severe that there is collapse of the dorsal wall. This particular dorsal wall is collapsed. In the radiology also you can find very good image of air is black in radiology. So you can see here, this is the tympany of the guttural pouch. You can approach or simply do the needle puncture, or you can do the surgery through those 4 approaches. This is a very important disease, mycosis of guttural pouch. So most commonly it is caused by Aspergillus species. Sometimes it is associated with epistaxis. Why? I have already explained. Because aneurysmal dilation of the internal carotid artery. Fungal plaques on the endoscopic examination, this is how you can diagnose this particular disease. 2 characteristic sites I told you. One is the roof of the medial compartment, already discussed. Another one is the lateral wall of the lateral compartment where the maxillary vessels are there. Okay, lateral wall of the lateral compartment. See this image is a very good image. This is a angiographic image, angiographic image. You can see the bulge in the internal carotid artery. This particular bulge in the internal carotid artery. This is aneurysm. This is aneurysm of internal carotid artery complicated by the fungal infection. Here these are the 2 images of fungal infection. You can see here some plaques, and if you notice, so these are the blood clots. These are the blood clots because of the epistaxis. Here there isn't any epistaxis, but you can see these fungal plaques. Here another one. These are the fungal plaques. Okay, you can see these fungal infection, and it causes the internal carotid artery to it causes the aneurysm of the internal carotid artery. Okay, so these are the all important diseases of the guttural pouch in case of horse. In the next class we will go for the esophagus. I was planning to do both, but sometimes I need my motivation also. By uploading these videos I find my motivation. So next we'll go for the esophagus. Okay, so till then, tata, bye bye, take care.